Breaking a bad news. In this breaking bad news, first of all, we have to prepare ourselves. That means we have to familiarize ourselves with the patient background, medical history, test results, and further management or treatment choice. And we have to mentally rehearse the interview, including the likely questions that is going to be asked by the patient or the patient relatives and the potential response. Arrange for a colleague, such as patient's name, nurse, or specialist nurse, to accompany you. Relatives can be in attendance, however, you must be guided by the wish of the patient. So, after preparing ourselves, we have to prepare for our setting. We have to arrange a private room, and please do not stand over the patient. We have to sit down and relax the patient so that we are not going to be rushed. And if you have recently examined the patient, allow them to dress before the interview, and all the disturbance like the pager or mobile phone should be in silent. And then we have to prepare now to the patient. So first of all, we have to assess the understanding of the patient, like how much they know about their condition. Like we can ask, can you help me by telling me what you understand about your illness? So after that, while many patients want to have detail about their disease or diagnosis, some patients do not want that much amount of detail, and we have to respect them, their wishes, and we should not impose their informations to the patient. So while we are providing now, this time we have to provide information. So we have to provide this information in such a way that uh, the patient understand our language. As the language of the patient, we have to tell the news, and we have to use non-technical words, like we can use spread instead of metastasis, and avoid excessive bluntness, and as it is likely to leave the patient isolated and later angry. Okay, so we have to set the tone, like we can say, I'm afraid I have some bad news. So next is we have to give the information in small chunks and stop periodically to check the patient understanding. We can say, is that making sense? Would you like me to explain more? When the prognosis is poor, avoid using terms such as there is nothing more we can do for you. We can't say this, as goal in care will change to pain and symptom relief. So now is providing support. First of all, we have to acknowledge and identify with the emotion experienced by the patient. When the patient is silent, use open questions, asking them how they are feeling or thinking. This will help them articulate what their emotions are. Like we can say, how are you feeling now? Do not say, I know how you feel. Even if you have had personal experience of disease or condition, you cannot know how an individual feels. So we can use empathetic words or terms by saying, I think I understand how you must be feeling. So allow the patient time to express their emotion, and let the patient know you understand and acknowledge their emotion. Unless patient emotions are adequately addressed, it is difficult for a doctor and patient to move on to discuss other important issue. But we have to remember that the patient crisis is not your crisis. So listen, now we have to provide a plan. How can we provide plan? Like by providing a clear plan for a future with treatment option or management plan should be discussed, and offer to meet and talk to family if not present. So after the interview, we can make a clear record of the interview in terms of used, the option discussed, and future plan. Ensure that the detail of the interview is shared with multidisciplinary team, including the general practitioner. Thank you.